So this is our December holiday edition of the Two Druggists podcast. We should be wearing like Santa caps or something.
It is. Actually, I should have some Christmas music playing in the background. It's after Thanksgiving. We're approaching the holidays. We should have on some gay apparel, but we don't.
No, because, well, I just don't think like that.
This is podcast number
seven.
Seven. Lucky 7. That's why it's going to be a good one.
7. It is. Today we're talking about alpha blockers. Better than beta blockers. It's alpha. It's top of the chart.
Alpha blockers are my favorite anti-hypertensive med, and alpha receptors are my favorite receptors.
Oh, why is that?
It's just something that hits close to home to me, I guess. I mean, they're everywhere in the body, these receptors. Yeah. They're in the smooth vasculature.
Yeah.
You have your alpha receptors centrally in the spinal cord and brain or whatever have you. So they're very important ones.
They are. How many types of alpha blockers do we have, or alpha receptors? I think there's 1, 3, 5.
So I was looking in the Bible. Correct me if I'm wrong. I'm not sure if there's a 3. I know there's alpha 1 and alpha 2 receptors.
Yep. Alpha 1, alpha 2.
Your alpha 1, they're in your, like I said, periphery, smooth vasculature.
Yep.
Those are your alpha 1s. Alpha 2 are in the brain and spinal cord.
Mm-hmm.
There's certain medications that can target them centrally to control blood pressure.
Right.
And back to the alpha 1s, we'll get into specific or selective versus non-selective alpha 1s.
Right.
I believe it's 1A, which is located in the prostate, so you have your uses there.
Yeah, that's our superstar.
I think it's 1B and 1D, which are others that are elsewhere expressed throughout the periphery. So you got a variety of receptors to hit on.
Exactly. And just like the beta receptors, these guys are normally modulated by catecholamines, epinephrine, norepinephrine, things like that. And alpha 1B is our superstar. It's in the prostate.
It's the all-star?
It is, because that's the most drugs we see for it.
Yeah. Yep, it's a lot of them. Fast-moving ones, as they say in the business.
Yes, that's right, the fast movers. As I recall, alpha blockers are first-line therapy for BPH, benign prostatic hyperplasia. That's a big term for your prostate turns into the size of a softball.
Exactly.
Not
or hopefully not a cantaloupe or a watermelon.
Right,
kind of want to catch it, nip it in the bud before it gets that large.
Yeah, and for go ahead.
But we're not getting into this much today, but alpha blockers don't shrink the prostate. They help with symptoms associated with the large prostate.
Exactly. They help restore the flow.
Exactly.
Yep.
Hence, Flow Max would be probably, I'd say, the fastest moving alpha blocker, wouldn't you?
I would. 0.4, 0.8 a day.
Mm-hmm.
Relaxes that smooth out muscle in the stroma of the prostate to relieve urinary retention. And so for our listeners who may not have as technical a background, the prostate sits right under the bladder, and men over 40, it starts to enlarge or grow, and it can impinge into the urethra and cut off the flow. So Flow Max relaxes the muscles and kind of pulls the prostate away. We could also talk about surgeries, but that's a whole other podcast.
Yeah. And the generic term for Flow Max that you'll probably see if you're working in a pharmacy is tamsulosin.
Yep, tamsulosin.
That's tamsulosin, Flow Max, same thing, used interchangeably.
Yeah.
They widen that muscle up in the around the prostate and help get you going a little easier.
That's right. It's every old guy's favorite, man, because if you can't pee, you're miserable.
Yeah, I mean, you
That's
sell
what I
tons
hear.
of it. We have 1,000-count stock bottles of it just to give you a picture of how commonly used it is. People in that certain age really do need the medication.
Oh, yeah. Interestingly, there are some older drugs in the class. Cordura. Let me look at my notes here.
Give us the
Doxazosin.
rundown.
So yeah, the rundown is afluzocin or urolactol. I think I butchered that one.
I don't think that's in the top 200 range, but that's one you do see.
You'd see it occasionally.
Alfluzocin.
Alfluzocin. Doxazosin or Cordura. We see that, but it's typically not for. We see that sometimes in the psych community for some reason. Prazosin or mini press. That one seems to be used a lot in rehab and psych off-label. One of my favorites, just because it's a bizarre name, is Sildocin or Rapaflow. That's our newest player on the block. Okay. And absolutely our superstars, Tamsulosin or Flomax, big generic, big mover. Dirt cheap at your local independent, by the way. And Terazosin or Hytrin, which is probably as old as the hills.
So you've listed them in alphabetical order.
I did.
Brand generic, which is good. I guess just to kind of separate the two as far as what they're used for, there's your selective and non-selective.
Right.
So ones that target the prostate alpha receptors would be your Flomax, Tamsulosin, and Rapaflow, Sialodosin, and Alfluzocin. So those don't reduce blood pressure because they're selective in that targeted area.
Right.
Whereas the other ones, you have your Doxazosin, Terazosin,
Prazosin.
I guess you could see sometimes for BPH symptom control, but those are primarily used to reduce blood pressure.
Right.
They're non-selective, so they're hitting those alpha receptors everywhere in the vasculature.
Exactly. And so for those listeners who may not have the best background in pharmacology, selectivity is something that makes a drug have less side effects in the body and tends to work better for the condition it's targeted at.
Right. So if I've been prescribed Flomax, I'm peeing easier, but I'm not falling over because my blood pressure is bottoming out. I don't need to reduce my blood pressure.
Right. And for the PharmD students out there, let's not confuse anybody. The alpha blockers are third line, so they're not big guns. They're definitely add-on therapy for blood pressure. That's in the all hat trial, by the way.
Yeah, you don't want to get somebody on board with a doxazosin before trying, a thiazide or an ACE or an ARB or maybe a beta blocker.
I think there is a particular reason why afluzocin is not typically used. I have a monograph here as reference and has some QT prolongation issues with it.
Okay. That's not something you really think of. Is that the only one?
That's is the only one.
Interesting.
And, in the elderly, QT prolongation, AFib, heart problems, that might be a reason why that one fell out of favor. Just theorizing.
No, it makes sense. The other two, I don't know how long they've all been around, but I think they've maybe been around longer than those also.
Yeah.
The Tamsulosin and the Sialodosin and the Rapaflow. Any other side effects with these other than like maybe a little bit of dizziness?
Well, I think dizziness is a big one, but the one that comes to mind for most any blood pressure med or repurposed blood pressure med is going to be your orthostatic hypotension. In other words, you change, you sit up really quickly or stand up and your blood pressure drops and you get dizzy, woozy, and fall over.
And not to get into too many guidelines, but I think these drugs are on a Beers criteria, which for you non-PharmDs, what that is, it's a list of medication classes and particular medications that either should be avoided altogether or used with caution in elderly.
Right.
And older guys that have this issue with the enlarged prostate are going to be on these alpha blockers.
Right.
So just something to keep in mind as far as informing your customer or patient when they are started on this new one.
Right. Now, Tamsulosin and Sildocin, Flomax and Rapaflow, since they're selective, there is much reduced side effect, and you can start them at therapeutic doses. Your other drugs, your Prazosin, your Terazosin, you're going to need to titrate up to avoid those side effects, dizziness, things like that.
start low and go slow, as they say.
Start low, go slow. I'm
Yeah,
a big fan of doing that, particularly with the CBD, but that's a whole other discussion.
Oh yeah.
Oh yeah.
Start low and go slow is good, really, for a lot of things. Grilling.
Yep.
If you're new to grilling, for instance, to start a low temperature, slowly increase it so you don't burn everything.
That's right.
Well,
it
applies also to alpha blockers.
That's right. Did you get a new grill?
No, I've had the same grill that I've had since we moved in here. So it's like pushing 5 years now.
All right.
It's done me well.
Are you grilling this winter?
No, it's closed up now. I think the last time I grilled anything was Halloween, actually.
Okay.
Getting better at it.
Total aside, since you're talking about grilling, I saw this really awesome forged by a blacksmith steak press. And it looked like one of the old irons. And you would essentially, hold it on, put it on your barbecue, heat it up, and then press your steak.
Sweet.
Yeah. So I went to the guy's Etsy shop and looked to see how much it would cost. And I just started laughing. It was an $85.
Damn. You must be, I mean, if you're a big grill enthusiast. So on Etsy, do you see a lot of people blacksmithing stuff?
I subscribe to Blacksmith Life on Instagram, so I see all sorts of cool projects.
Okay.
Like there's a guy in Pittsburgh who does Damascus and gold rings.
Okay.
So like wedding rings, a set.
Yeah.
You and your wife or fiance can go to this guy's shop and he will help you make your own wedding rings for the low price of $1,800.
That's not bad at all.
No.
And it's custom. You kind of tell them what you want.
Yeah, it's custom.
Gotcha.
Yeah, they let you. Barefoot Forge is the guy's Instagram.
Okay.
It barefoot because something to do with walking in the footsteps of Jesus is his thing, and that's cool. The guy does amazing work. But anyway, that was an aside from grilling. Back to alpha blockers.
Yeah. So not just to help get the flow going for BPH, that is. Sometimes you'll see off-label, like a little bit of Flomax, sometimes 2 capsules or 0.8 milligrams total as a dose.
Yep.
Given to help you pass kidney stone.
Yes.
We'll see a little bit of that used off-label, typically with some oxycodone or pain medication.
Yep.
And that from the emergency room. So not uncommon.
It is definitely not uncommon. You also see that from urologists after TURP, the transurethral prostate roto-rooter.
Not something that sounds pleasant.
No, actually, there are videos of it on YouTube, and I watched one and I cringed.
Can you describe it in lay terms for our non-medical background?
Yeah, sure. So imagine your urethra as a pipe, and in it you have these inclusions that are kind of rounding over and closing off the lumen or the area, empty area, and they take this uroscope with a heated metal loop. It goes up and it like carves it out. And I watched one just because this was actually back in pharmacy school because we were talking about this whole unit. And I watched one and I'm like, I hope to God I never have to do that.
Man. I really wish we had the ability to put that video up right now. And
we could
just analyze it play by play.
We'll and cringe and talk about how many opiates you'd want.
While we're on the cringe-worthy discussion,
I
alpha
love
blockers, they've got some bad cringy side effects.
Awesome. What do we got?
Well, for the tamsulosin, alfluzocin, silodosin, Rapaflow, Flomax, Uraxol, the ones for BPH, remember, these have your side effect that I'm seeing abnormal ejaculation. And this is especially with the Rapaflow and Flomax, your tamsulosin. So when I was reviewing this, I asked my Amazon Alexa what that is, what retrograde ejaculation is, because it happens in 28% around of Rapaflo people or Tamsulosin people being on there. So you're
Right.
talking about a quarter, 25% or so of people will experience this. It's not anything
Wow.
that's harmful or painful, but it causes, I guess, a reflux of the semen into the bladder.
Oh.
So you'll get very little semen or dry orgasms, as they say, sometimes when you start on these medications.
Okay.
But that goes away if you DC the drug. So
Interesting.
it's not,
but then you can't pee.
Yeah, I didn't get too far thinking down that line how that works.
Yeah, my brain would have stopped at retrograde. That would have caused a problem. You know who would have
about that,
Oh yeah, if somebody complains about that, of course. Now,
the offending agent.
Yeah, that's true. Unless, of course, they're on a bunch of psych drugs, then it gets a little more murky.
Right.
Because some of them can do that too, off the top of my head.
Oh yeah.
So the question is, how does that affect a guy like Ron Jeremy?
Oh, I don't know. I mean, if I were him and I was knowing that I need to perform for a scene coming up, I would consult my druggist about whether or not to discontinue my Flomax.
Right. Or maybe switch to less selective alpha blocker to prevent that.
Yeah, possibly.
Yeah, but that's really the only time I could see that whole side effect could be a issue, and if you're in that line of work.
Right. There's an industry for everything.
There is. And we're definitely not courting their sponsorship. Although, if our friends at Blue Chew want to send us a couple grand, we can do some commercials for you.
Oh yeah.
Yeah.
Blue Chew, man. We got it. Do we have any sponsorships yet, Matt?
Well, we still have one patron on Patreon.
Okay.
We do not have any sponsorships as of yet. There is a thing with Anchor Podcast where you record an ad and they pay you per 1,000 listens.
Okay.
So I don't think we're there yet.
No, we're working there though.
But we are. The merch store is up.
We got to provide the link for the viewers at the end if we can.
It will be. It's I set us up with Linktree.
Okay.
So Linktree is neat. It's a free link service. So it's Linktree, Two Druggists. You get our YouTube, you get our Anchor Podcast, you get our Instagram, you get our Patreon, and you get a link to the Two Druggists merch store.
Okay.
And the Two Druggists merch store, you and I need to put in an order to get some T-shirts to wear on
we got
video.
To.
Yeah.
It's getting a little cold out. Maybe a hoodie. We got
maybe
hoodies.
A hoodie, yeah, and a coffee mug.
Yep.
Because
hot
cocoa, hot toddy.
Yeah.
Although a hot toddy with the Flomax probably wouldn't be a great idea.
No, probably not. I'll get you really peeing.
That would. But yeah, the merch store's up. For any of our listeners that get Two Druggists merch, we will love you, and we want you to tag us on Instagram at Two Druggists merch.
I can't really think of a better Christmas gift either than like a Two Druggists T-shirt or hoodie.
No, I can't either. And the beautiful thing is, and the beautiful thing is, we've set the prices low so that you can buy the merch, and we only make a couple bucks. So we're not looking to get rich. We just, a little bit of cash, a little bit of jingle.
Spread the word.
That's right.
Exactly. Think of it as you're walking by the Salvation Army bell ringers. That's us with the merch.
That's right. We're ringing the bell.
Any penny you can spare.
Two starving druggists, burdened by student loans, and in need of new laptops and microphones. So every dollar counts.
It's a dark winter we're approaching into.
It is. That's what Robert Redford. Who the hell's the director?
GDC guy?
Yeah, that guy. Yeah, he said we're going into
right?
a dark winter.
That's why you can also gift your secret Santa a rapid COVID test.
That's
so you
true.
Can just be carefree throughout your holiday weekend, knowing that you do not have coronavirus. Alpha blockers that you see for behavioral health, as they sugarcoat it now,
Yep.
in with psychiatric meds, so
Yep.
your antipsychotics, antidepressants, things like that, you'll see prazosin or possibly doxazosin given at bedtime.
Yep.
And either that's for nightmares, PTSD. People use it more or less just to kind of help prevent those symptoms with whatever issue you may have.
Interesting.
So there's been, this checks out, you can look it up. There's been a shortage or an upsale of prazosin for night terrors for Trump supporters after the election.
Oh, no shit.
And the PTSD that they've experienced from that.
You know, there is at least one patient that I can think of that calls our pharmacy on a weekly basis that would help. This individual has expressed to me many times they don't know what they're going to do about the stolen election. So maybe she needs some prazosin, or he or she needs some prazosin to help with the nightmare.
All jokes aside, though, you see it fairly commonly. I mean, for the alcohol, drug, and abuse facility that we service at our pharmacy, you see a lot of people using that at bedtime.
Oh, yeah. And
prazosin or something like that.
And it's interesting because they seem to use that over clonidine.
Yeah.
And clonidine we see a lot in the ADHD realm for sleep induction when kids are on, long-acting stimulants. But yeah, the mental health community is all over prazosin.
Yep, it's a popular off-label choice for nightmares, PTSD, and sleep, things like that.
Well, now that makes a lot of sense. I've often wondered why they were using it, and it almost seems like it's, everybody gets it.
I take that particular.
Oh, you do?
I use 2 milligrams every night.
Excellent.
Because I experience nightmares like most pharmacists do, nightmares of causing bodily harm to both coworkers and customers.
Oh, good.
But since I started prazosin, I've slept much better.
Good. Well, you know the old saying from the 70s, if you need compliance, there's always Thorazine.
Chemical straitjacket.
That's right, which is not endorsed by either druggist.
No.
Well,
is CBD safe to take with alpha blockers?
Sorry, say that again?
Is CBD safe to take with alpha blockers?
Oh, most definitely. Alpha blockers, there's no known drug interactions with CBD or any other natural supplements off the top of my head for that matter. And CBD,
other than your blood thinners that most people,
right?
I think realize.
Now, interestingly enough, a couple of these guys are targeted by the P glycoprotein transport system.
Okay.
And
what's that in lay terms?
So when we swallow a pill and it goes through the GI tract, your gut gets down into the intestines. You can think of it as a bunch of little robot arms reaching out and grabbing things and pulling them into your body. The P glycoprotein system is one of those arms that will pick up and grab things and transport it into your bloodstream.
Okay.
You can kind of think of it as an assembly line with the robot arms just kind of grabbing stuff and flipping it over into the right bin. Sildosin is a substrate for P glycoproteins. So that is a mechanism. If you inhibit those, you'll reduce the concentration of that drug in your body. Okay. And it's just one of those things that the PharmDs out there are going to need to remember about sildosin. If you've got something that mucks up your P glycoprotein transport, that would be an issue. Also,
you said it's an inhibitor of that mechanism?
No, if you inhibit the P glycoprotein transport, you're going to drop your concentration.
Okay.
It's a substrate. It will preferentially grab that drug.
Gotcha.
Yeah.
What else here?
Go ahead.
Priapism can happen with alpha blockers.
All right. What's priapism? It can also happen with trazodone, but
Yeah, but I guess with non-selective alpha blockers, more so your doxazosin, Hytrin, those guys, they cause, I guess you could word it, too much vasodilation, which can lead to having, it is not a wanted erection.
right.
It's a medical emergency, 4-hour or longer erection that requires medical attention,
medical intervention.
It can lead to other complications.
Yep.
So,
and it's that particular unwanted side effect can actually damage that appendage.
It's not wanted. It's not a good.
Can also be painful.
Yeah.
It's
you wouldn't want to take Blue Chew if that happens to you either. Hold on to the Blue Chew.
Yeah. Speaking of our joking sponsor, Blue Chew, which is not yet a sponsor, but we would gladly take their money. One of our farm techs at work suggested we should try to jump on the bandwagon and get the online games to sponsor an episode.
That'd be cool.
Yeah,
we'll take any sponsorship. Why not?
Yeah, exactly. Yeah,
we can educate the gaming community.
That's right. A point for our PharmDs out there. Sildosin or Rapaflo is one of the few alpha blockers we have to worry about the kidneys.
Okay.
Creatinine clearance less than 50. We have to dose adjust and lower your dose. And if you're less than 30, it's a no-go.
I'm kind of cross-referencing you here too. Alfluzocin has restrictions also.
Okay, that wasn't in my monograph.
Your Flomax does not. So that's a beneficial, I guess, more so reason why people would lean towards Flomax.
Right.
No creatinine clearance restriction, no QT interval prolongation.
Excellent.
So overall, just a few less side effects. I'd want Flomax over the others if I needed one of these.
Oh, yeah. Flomax is nice because you can combine it with the 5-alpha reductase inhibitors, the finasteride or the dutasteride.
Oh, yeah.
And then you get the dual action P-flow.
Yeah, man.
Yeah.
You're shrinking the prostate and opening up the smooth muscles.
That's right. Although we were talking about dosing restrictions, most of the other ones have hepatic dosing. So in hepatic impairment, you're going to have to reduce doses.
And your reference for that is what's called the Child-Pugh score, correct?
Oh, yeah.
Which is, it's, trying to think the right word. It's a standard for liver disease. So it goes through A through D, I believe, D being the most severe. And you kind of dose your drug based on that score.
Yeah, it's like you look for ascites, encephalopathy.
That's a good topic we could do one day.
Yeah,
cirrhosis. So yeah.
Did we run down starting doses on these guys?
I don't think we did, no. So I guess we can go with like if you're using it for blood pressure, you usually see these starting at like 1 milligram. I'm thinking of most is prazosin, which goes 1 through 5 milligrams daily initially.
Right.
But I'm seeing here in my Bible that it can be increased to 2 or 3 times a day.
Correct.
If you're still getting that uncontrolled hypertension.
Right.
Your terazosin, for whatever reason, looks like it's 1 or 2 milligrams at bedtime. I'm not sure why just at bedtime. Maybe it has more of those side effects as far as your fatigue and dizziness that you'd want to kind of sleep through.
Yeah, I agree. May cause a little drowsiness.
Oh, yeah. And your doxazosin, you were all in the same ballpark still, 1 to 4 milligrams daily. So I guess the key difference is prazosin can be increased to 2 or 3 times a day. The others not.
And we have some max dosages. Doxazosin, not Zoshin. 16 milligrams a day is your max.
Okay.
Prazosin, a whopping 40 milligrams per day.
Damn, so you can really titrate that one up.
Yeah, man. 5, 10 milligrams twice, 3 times a day. which also would indicate it probably has a pretty short half-life.
Yeah.
Yeah. And then terazosin is 20 milligrams a day.
Okay.
Yeah.
And interesting, like we were talking about going low and slow.
Yep.
I'm seeing here, especially with the first dose of any alpha blocker, that's where you will notice syncope, which in lay terms is fainting, your orthostasis, feeling funny as you get up. So it's something your body will generally acclimate, but those typical side effects are something you'll notice right away with the first dose of that medication.
Yep.
Something to educate your customer about.
Exactly. So you don't want to take it and then go for a drive.
Right. Or operate heavy machinery.
Or juggle chainsaws.
Yeah. Or
Actually,
blacksmith.
I don't know. Yeah, you wouldn't want to do that either.
Okay.
You know what the secret to juggling chainsaws is?
What's that?
Figure this out. You juggle the chainsaws that don't actually have a blade on them or a chain. It
We used
just
to
has
work.
the bar.
We used to work with a guy that did that.
Did he? Which arm did he lose?
I haven't seen him in a couple years now, but he had both arms every time I ran into him. Yeah, man, he was a professional juggler. I'll tell you who he is after we're done.
Okay, that's interesting.
It might have been.
Wait. Was he a clown too?
Maybe.
Okay.
It might have been before you came on board.
Yeah.
It was another location.
Oh, yeah. Okay, it probably was.
But he's an interesting guy. I'll tell you, man.
Okay.
Juggling it's a cool thing to do, man. But you probably wouldn't be very good at it after your first dose of an alpha blocker.
Nope, definitely not. Interestingly enough, there's been a Cochrane review.
Okay.
And for those of you that don't know, Cochrane reviews are well-regarded meta-analyses that look at all the good evidence for drug use and various other treatments.
Interesting.
And a Cochrane review found that tamsulosin, sildosin, and all have comparable efficacy for the treatment of BPH, as well as afluzosin. So if somebody asks you which one's the best, they're all about equal. It's which one you tolerate the best.
Right. Interesting. So then you're kind of just going on your side effect profiles and tailoring it to your patient's needs.
Exactly. If you don't tolerate one, you switch to another and see how you do.
This morning when I was reviewing this stuff, I did go down the rabbit hole.
Oh, yeah.
And there's two alpha blockers that I didn't think of, and it's not even in my Bible here. The first one's really old. I think I looked it up. It was the first one ever made, 1976, phenoxybenzamine.
Wait, we use that for animals.
We use it to compound for animals, cats and dogs.
Oh, wow.
That's an alpha blocker. It can be used for, your urinary retention, that sort of thing. Mm-hmm. It can also be used for hypertension, which I'm not this smart. I'm literally reading off in front of me.
Yeah.
Treatment of hypertension caused by pheochromocytoma.
Isn't that a tumor of the adrenal gland?
Correct.
Or the kidney?
So it upregulates your release of those catecholamines, your norepinephrine, epinephrine.
Right.
And what's interesting about phenoxybenzamine that I read about, its half-life is over 24 hours.
Oh, nice.
It's irreversible, non-selective. So it forms this covalent bond with the alpha receptor and gives longer lasting effect versus the newer guys. So phenoxybenzamine, as you could probably gather, has a lot more side effects with your excessive lowered blood pressure, fatigue, dizziness, that sort of thing. It's very long acting.
Okay.
So that's an interesting one we see in veterinary use, but it was used in people prior to that.
Wow. You said 1976?
76. It was the first alpha blocker.
That drug is 1 year older than I am.
Okay.
So I guess I'm old. So we did talk about some of the bell ringer big adverse reactions, but as we discuss, there are a number of adverse reactions that kind of falls in this drug class. And remember, when you look at a package insert or a list of side effects, you need to look at it with a bit of a rigorous eye, because some of these are just legally reported because they showed up in the clinical trial.
Okay.
Diarrhea, dizziness, headache, rash, drowsiness, nausea, infection, palpitation, pharyngitis, rhinitis, urinary incontinence, ejaculatory dysfunctions, fatigue, nasal congestion, back pain, cough, edema, polydipsia, and weakness.
But you're not going to get all of those side effects.
No. But that covers our FDA disclaimer, just like they do in the commercials. You know, drug X will give you blah 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 blah, and you may die.
Right. But if you're on an alpha blocker, don't stop taking it if you notice any of these. We're not responsible for your idiocy, remember. So consult with your
medical professional.
Yeah.
Speaking of that, that's the slogan on our mug.
Yeah. Now, why would you not want that mug?
Damn right, man. We did not discuss floppy iris syndrome.
Yeah. What's that?
As I understand it, it is an inoperative thickening movement of the iris that can be observed during cataract surgery in the elderly.
Okay.
And apparently tamsulosin, doxazosin, and terazosin have a high incidence of that. So if you have upcoming cataract surgery, make sure you talk to your doctor.
Okay.
It can also cause meiosis or constricting of the pupil.
Okay. So it's got some effect on
it does.
The eyeballs.
Of course, most of our alpha blockers are metabolized by our liver enzyme, our number one, 3A4.
That's a big boy.
It is. So avoid your things like ketoconazole and verapamil, diltiazem, nifedipine can also interact.
Yep. But overall, pretty safe, I'd say.
Yeah, I mean, this
not many interactions. Severe ones, contraindicated ones.
Yeah, no, we don't get normally any red boxes on the pharmacy system for these guys. They're pretty clean, well tolerated for the most part too.
Yep, your body can acclimate to that sort of orthostasis fatigue, lowering the blood pressure over time.
We do need to warn our listeners that mixing our alpha blockers like tamsulosin with the ED drugs. That's your Viagra, your Levitra, your tadalafil, may lead to Blue Chew, yeah, may lead to symptomatic hypotension. So you have an additive effect there,
right?
Because
amplifying those said side effects, right?
Okay. Yep. The alpha blockers make the pipe bigger, and the PDE5s or the ED drugs pump up the flow, so you can have low blood pressure.
Another educating point that you'd want to tell your new customers starting next, if you see that little flag, and hopefully your good pharmacy software that kind of alert these things.
And again, afluzocin and sildosin, you're going to want to watch out for that QT or electrical heart prolongation.
Okay. If we have time, I have one more alpha blocker that you don't really see in the retail setting.
We have time. It's 111.
Yeah. Phentolamine is one more that I found on the Wikipedia. Just a quick Phentolamine.
Yeah, I've seen that compounded too.
I have not, but I believe that it probably could be used. You see it in hypertensive emergencies a lot of time from what I saw.
Okay.
So it's a non-selective alpha blocker that you could probably surmise. So you're really, it's injectable. That's really going to increase blood flow by open up those blood vessels. And interestingly enough, it's very useful in cocaine-induced cardiovascular complications.
Oh, your cocaine-induced vasospasms.
Yep. So if somebody comes into the emergency room with the chest pain, vasospasms, ventolamine's useful only when you don't get a fully responsive or relieved patient from a benzodiazepine, nitroglycerin, and your calcium channel blockers. So it's a last resort, but a good one to throw on there if somebody's still not responding to those other treatments.
Right. Now, we've talked a lot about BPH, or benign prostatic hyperplasia, or enlargement of the prostate. We should probably say a few words about that these drugs are also used in people with prostate cancer.
Okay.
But you need to know, and of course, when you consult your physician, they will do this. If you're having symptoms of low flow, inability to pee, frequent urination, if you think it's enlarged prostate, you need to rule out prostate cancer before you start these drugs.
Okay.
Now, they can be used during treatment, but you definitely need to rule out that more serious condition. 1 in 3 men in the United States is going to have prostate cancer.
Okay. So it's something that needs to be ruled out first.
Most definitely.
It seems common sense, but a lot of times you don't think about that.
No, definitely not.
So good to know for possibly our older listeners.
That's right.
That might need one of these. Rule out anything else that might be underlying.
Exactly. And yeah, so man, I think, have we covered everything?
I think so, and we're just about wrapping up in the time frame here. That was excellent. That blew by pretty easy, man.
Yeah, it did. All right. Well, that was a lot of fun, Ben. Thanks for joining us on the Two Druggists podcast. Well, obviously you, Ben, but our listeners, of course.
Yes.
Be sure to check us out on Anchor, Breaker, and the 6 other podcast platforms that we're listed on. And of course, follow us on Instagram. Email us comments or questions or hate mail.
Yep.
Snail mail, contact us if you want to send us actual cash. We'll let you know that address.
Yeah, if you're interested on coming in on the show, we're welcome to guests. Just email us in. And for our female listeners, when you check out the merch store, we do have leggings. We didn't mention that.
No, we didn't.
We got Two Druggist leggings for you, lovely female patrons.
That's right. And if you do buy the leggings, and please send us a picture that you're modeling them.
Oh, yeah.
Yeah, that'll go up on Instagram.
Yep, IG. Yep. Follow us.
Follow us on Instagram. If you're truly in the zone with the Two Druggists, head on over to Patreon and maybe think about subscribing.
Yeah.
And eventually we'll have some really excellent patron-only content.
We're only on episode 7. We're going to pick up the quality and the content. Just wait.
That's right. All right.
All right,
thanks,
man.
everybody. Have a great day.